Right, so let's dive into this claim that's been making some serious waves. Imagine a company, famous for past quirks like Clippy and, yeah, even Windows Vista, now asserting that their AI is actually smarter than human doctors. Sounds pretty audacious, doesn't it?
It absolutely does. And what's truly compelling here is that this isn't just like a speculative boast. We're talking about research recently unveiled by Microsoft. It's about a tool they've developed called the Microsoft AI Diagnostic Orchestrator, or MAI DXO. It's a genuinely significant step, especially when you think about how AI might radically transform, well, the whole landscape of complex medical diagnostics.
And you, our listener, you've given us the perfect lens to explore this. An incredibly insightful article from June 30, 2025, detailing Microsoft's research into this MAI DXO. So, our mission for this deep dive is clear. We're going to extract the most vital insights from this material, not just to understand what MAI DXO is, but maybe more importantly, to critically examine how it actually performs against human physicians. And, what these findings could fundamentally mean for the future of healthcare, for you and for every doctor out there. That claim, though, outperforming doctors, that's massive. So how exactly did they put this AI to the test? Were the conditions truly comparable for the AI and the human physicians?
Yeah, that's the crucial first question, isn't it? Microsoft conducted a head-to-head evaluation. They used actual case records from the New England Journal of Medicine. These are complex cases, and the results were, well, frankly striking. MAI-DXO correctly diagnosed 85.5% of the 304 cases presented.
Wow, 85.5%. And how did the human physicians fare against that?
Right. So on those very same cases, a group of 21 experienced US and UK physicians, they achieved an average accuracy of just 20%.
20? Only 20%?
Yeah. So a really significant disparity in diagnostic accuracy there.
That difference is, well, it's astonishing. And the article also mentioned efficiency, right? That the AI wasn't just accurate, but also use fewer diagnostic resources
Yeah.
and delivered lower associated testing costs. What's the real impact of that beyond just the numbers?
What's truly revolutionary about this virtual cost idea isn't just measuring efficiency. It's like it embeds a financial discipline directly into the AI's diagnostic process itself. So this means MAI-DXO is designed from the ground up to not just be accurate, but to be cost-effective, which, is a game changer as U.S. health spending nears, 20% of GDP?
Okay, that makes sense.
And to your earlier question about comparability for the humans, this is really vital to note. The conditions for the human physicians were quite specific. They were, and this is a quote, limited to individual work without access to textbooks, peers, or AI tools to ensure a direct performance comparison.
Hold on. So the human doctors were essentially handicapped, working alone, no books, no colleagues. Doesn't that significantly skew the comparison? I mean, it raises questions about how applicable these results are to real-world clinical settings, right, where doctors do collaborate and use resources all the time.
It certainly raises an important question about the study setup, yeah, and it's a limitation the research itself acknowledges. The goal, it seems, was to isolate that individual diagnostic capability, which makes the AI's performance maybe even more notable in that specific controlled environment. But if we zoom out a bit to understand how MAI-DXO actually achieves this, it's not a single AI. It's not one big brain. Instead, it's an orchestrator. It integrates the strengths of multiple large language models. These are powerful AI programs trained on massive amounts of text, like GPT, Claude, Gemini.
Ah, okay. So it's not one super AI, but more like a virtual medical dream team. The best diagnosticians from different specialties all kind of working together.
Precisely. That's a great way to put it. It actively simulates a real-world diagnostic process. The tool is designed to mimic how a human clinician would work. It asks follow-up questions, orders tests, and refines their diagnosis step by step. It evolves its understanding as it gathers more data, just like a doctor would.
It's almost like imagining a highly efficient, tireless Sherlock Holmes of medicine, isn't it? Maybe without the deerstalker, presumably. What's really compelling, though, given what you said about costs, is this virtual cost idea again. How did Microsoft even integrate economic efficiency into an AI? And what does that mean for how the tool actually makes diagnostic decisions?
Right, so each diagnostic decision the AI makes, it incurs this virtual cost.
Yeah.
This let the researchers measure both accuracy and economic efficiency at the same time. And this unique flexibility means MAI-DXO can sort of balance diagnostic thoroughness with cost-effective care. The platform is built on this idea that AI doesn't need to choose between the depth of a specialist and the breadth of a generalist. It can have both. and that allows it to match or even exceed human performance in these complex cases that span multiple organ systems, specialties, disciplines.
Okay, so we have this incredibly accurate, cost-aware diagnostic assistant. Given these capabilities and its unique approach, the natural next question is, well, what does this actually mean for healthcare as we know it and for our interactions with doctors? Is the writing on the wall for human physicians?
Well, Microsoft is very clear on this point. They emphasize that MAI DXO is not intended to replace physicians, but to augment their capabilities. The vision, really, is that AI tools like this may soon have a much deeper role in everyday clinical decision-making. Especially, for those highly complex cases we've been talking about. They could provide real-time diagnostic support, maybe reduce costly and unnecessary testing, and significantly extend the diagnostic reach of frontline providers, those who might not always have immediate access to a specialist.
So it's not about replacing doctors, but empowering them, giving them a kind of superpowered diagnostic assistant. I can imagine, like, a rural doctor in a small clinic suddenly having access to the diagnostic horsepower of a panel of world-renowned specialists. It could help clinicians navigate rare or unfamiliar cases more confidently, right? And maybe even support patient self-management for more routine conditions down the line.
That's exactly the exciting prospect. But, and this is important, we must address the limitations the source points out. This research primarily evaluated performance on complex NEJM cases. These are often unique, well-documented cases. It doesn't yet really cover the more routine or ambiguous cases you often encounter in primary care, or cases with incomplete information. And as we discussed, the human physicians in the study worked alone without their usual access to resources or team collaboration, which, in a real clinic, that's absolutely standard practice. Collaboration is key.
Right, right. So it's an impressive first step, definitely. But it's not quite ready for prime time in every single clinical scenario. Microsoft acknowledges that important challenges remain.
So what are the next steps for MAI DXO then? Where do they go from here?
The immediate next steps involve testing it in real-world clinical settings. That's crucial. And establishing regulatory pathways for deployment. You can't just roll this out. Microsoft is actively working with health organizations globally to evaluate its safety, reliability, and practical integration into existing workflows. How does it actually fit? Their overarching vision seems clear, though. They strongly believe the future of healthcare will be shaped by augmenting human expertise and empathy with the power of machine intelligence.
Okay, so let's recap. We've taken a deep dive into Microsoft's MAI DXO. We've uncovered its really impressive diagnostic accuracy on complex cases and its potential for more cost-effective care. It's a compelling look at AI's role, not as a replacement, it seems, but as a powerful augmentation for human expertise. Absolutely. The evolution of how technology can support and enhance human capabilities in critical fields like medicine is truly remarkable. And while the source makes it clear that, yes, important challenges remain before widespread adoption, the opportunities this presents for improving patient care are, well, undeniably energizing.
So thinking ahead, as AI tools like MAI DXO continue to evolve, how might your relationship with your own healthcare provider shift? And what new possibilities or even maybe new responsibilities might emerge for you as a patient navigating this increasingly intelligent medical landscape? Makes you think, doesn't it?